Welcome to the Teeth and Toes podcast. I'm Dr. Curtis Westersund, and I'm a dentist who treats TMJ problems. Now, Teeth to Toes is a podcast where we ask healthcare providers about around the world, healthcare providers around the world, to answer questions asked about the teeth, the jaws, the body, and how they all work together. Many people have jaw, TMJ, and neck pain. And there's a lot of confusion amongst dentists and patients how to get treated for these various problems. This podcast is for both TMJ sufferers and healthcare providers, including medical doctors and dentists who offer care for those who have TMJ-related issues. To keep the podcast from being an old dentist rambling on like right now, I'm going to be joined by a great co-host, Kira Scholten. Welcome, Kira.
Hello, happy to be here.
Kira is a great friend and is really interested in the way the body functions as from a layperson perspective. She's here to keep me from nerding out on stuff. And I actually think she knows our first guest, who happens to be a fantastic upper cervical or upper neck chiropractor, Dr. Jeff Scholten. Is that right, Kira?
I do know that guy. Yeah, I did. I met him many moons ago, liked him so much I married him.
Ah, you guys are husband and wife. Okay. That's going to help. So now, many people are going to ask, why would a dentist be interested in things past the teeth? A dentist should just be interested in the 32 little pearly white teethies. And the TMJ is part of the lower jaw, which kind of makes it a dental thing. So why the interest in the neck? For goodness sakes, patients want to have, and dentists want to have a simple fix for these problems. Something like a pill or maybe an injection, something quick and easy. But sometimes things are more complex and we have to seek out other healthcare providers. Is that right, Kira?
Yeah, for sure. I've been working with Jeff for a long time. We've been in practice, him in the back and me in the front for over 20 years, and we've seen a lot of people come in, and people just want quick solutions if possible. I wish we could. I know you wish the same thing. We all wish we could give that to somebody, but sometimes the body's a little more complicated than that. Needs a little bit more help than just one person can give.
That's absolutely right. And that brings me to having a very special guest with us today. This doctor has been a friend and an integral part of my TMJ practice for over 2 decades. He's been a mentor, not only for me, but for dentists and healthcare providers around the world. He holds a diplomate status in chiropractic medicine. He's been the past president of the National Upper Cervical Chiropractic Association, or NUCA, and he's been involved in a whole bunch of chiropractic associations. He has taught me a lot. I, as a dentist, wouldn't know anything without Jeff's input, and the work we've done together for the last 20 plus years has made me up my game of anatomy, neurology, physiology of the body, and all its interactions. And if you asked our wives if we would say that at a barbecue, our families tends to see us drifting toward problems that we see every day, that's kind of the nerd thing that I do with Jeff. And hopefully Kira's going to be there to help bring us back to the level of normal people. So without further ado, Jeff Scholten, welcome to the Teeth to Toes podcast.
Well, thank you both for having me. It's a real pleasure to be here with you today.
So, Jeff, I have a lot of patients that come to me and I recommend that they have their neck assessed just as much as I would be assessing their jaw. And they've been given information about not to go to a chiropractor of any sort. Their medical doctors are saying, oh no, don't go to... Their medical doctors are saying, oh no, don't go to a chiropractor. They may have this impression that chiropractors aren't somebody that's like a real doctor. Can you speak to me about that and inform us about what type of chiropractic medicine that you perform and how that's a help to our patients?
Yeah, absolutely. I mean, chiropractors aren't medical doctors, just as dentists and podiatrists aren't medical doctors. And there's a lot of different types of clinicians out there that I think are necessary for patients to get the results that they're looking for. The challenge sometimes is that, as you know, none of us learn about each other's professions in school. And so sometimes people go outside of their scope of real true understanding and might make recommendations about not seeing this practitioner or this other practitioner. You know, I, for one, never would suggest that a colleague of mine who's educated in the chiropractic world would tell a person when or when not to see a dentist or when or when not to see a medical practitioner. So I think if you're a patient and one of your health practitioners is telling you not to see another healthcare practitioner, I just think you should ignore their advice. I don't think that's great advice. So seek out some friends that maybe have seen that type of practitioner and find a good one, because like everything, there are people who are really, really into what they're doing and are really fantastic and hopefully will give you a great experience, and people who aren't. And so I hope all of our listeners here always find great practitioners for themselves to be able to be helped by.
I got two questions. One question is, why would a medical doctor warn a patient about seeing a chiropractor? What is it about their profession that's so different from my experience?
Yeah, well, your experience in speaking with them is really different than my experience in speaking with patients, because, of course, I have a biased sample. I have people who are actually coming in to see me. But I do have people who are scared to see me, of course, because chiropractors' interventions will sometimes involve adjusting the neck in a way that would be termed maybe a manipulation by some, and so a crack or a pop of the neck, and that can be scary for people. And so I think medical doctors, they're people too, and they might be scared of that. They might not understand it, and they might not understand the training that a chiropractor has. You know, most chiropractors, they're going to go to university for a few years, maybe finish their undergraduate degree before going to chiropractic college. And then typically chiropractic college is a 4 or 5 year degree, depending on where you're going, so 4 or 5 academic years. And so chiropractors have a lot of education and a lot of training to know when to employ the techniques that they use and when not to. So if you found a good chiropractor, the best person to ask if you need to be intervened with or how you need to be intervened with is probably that chiropractor. But in the field of chiropractic, there's a lot of different types of procedures. And so the majority of chiropractors do similar procedures, but there are also a lot of distinguishing variables. And without making this kind of a podcast that's educating completely on all the different kinds of chiropractic, you know, one kind of chiropractic that I do is upper cervical chiropractic. And as you mentioned, I have a diplomate in chiropractic craniocervical junction procedures, and I'm really involved with that subset of my profession. I teach in it, and I am taught by it, and so we try to learn as much as we can about the head and neck. And we can't really separate the head and neck from the bite because the upper teeth are connected to the head, and so the only way to move the upper teeth is to move the head. And so when we're talking about the TMJ, we've got the temporal mandibular joint, and the temple part is part of the skull, and the skull connects to the upper neck. And if the upper neck's been injured, then the skull can be crooked, or your head could be maybe not on straight. And if that's the case, then the T part of the TMJ maybe needs to be controlled as well. And Curtis, we've talked a lot about that over the years, haven't we?
We certainly have. Kira,
Yes, they have.
I'm going to tell you something that I tell my patients, and that is, in the 43 years that I've been a dentist, I have never had a patient to come in to me with just their head. They always come in with their head connected to their neck, connected to their torso, and some assortment of limbs, typically 4. But I'm not prejudiced against any less limbs. I've never seen more than 4, now that I think of it. But anyway, the point is, they always come in all connected.
That's
and
true.
I think that's probably what Jeff is referring to.
I think that's what he's getting to, yeah. Your teeth don't just come in floating by themselves.
No, and I've never had anybody bring in their head by their significant other brings their head in a bucket or something. It's always connected.
Yeah.
So Jeff, this whole upper neck thing, head thing is pretty important for patients' health. Kira, I don't know if you know this, but in the 43 years I've been a dentist, I have never had one patient, not even one patient, that has come in without their jaws attached to their head attached to their neck attached to their torso, and some assortment of limbs. Typically 4. I'm not prejudiced about how many limbs. I've never had anybody with 5. That would be interesting. But nobody's
So you've never had
their
anybody
head
walk in
back
with their tooth in their hand and say, "Can you fix my tooth for me?"
Yes, or probably more practical, with their head in a bucket brought in by their significant other saying, "Fix them." So I've never had that happen before. So head and neck being attached is kind of universal, I think, for everybody. Is that right, Jeff?
Yeah. Well, I've never seen a patient without their head connected to their body by their neck. You're absolutely right about that, Curtis. And yeah, that's why we think it's such a vital and complex area, that just deserves dedicated attention. And so that's where we focus when we're dealing with the upper cervical spine and NUCA, is how that connection of the head and neck, how it relates to the rest of the body. The neck is really responsible for the tone of the body. So a lot of chiropractors, they deal primarily with joint functional mobility, and they help lots of people doing that, getting joints moving. And motion of the body really starts in the pelvis. Radovinsky and the spinal engine, he showed how motion starts in the pelvis, but the tone of the body starts in the neck. As you can tell by, if you were to catastrophically fracture your low back, your legs wouldn't work. And if you were to do the same thing to your neck, if you were to really injure your neck badly, your arms and your legs wouldn't work. So there's sort of a downstream effect. And so when you have an injury to your head and neck, that causes all sorts of imbalances in the rest of the body from a reflexive relationship. And that creates postural asymmetry in patients. And when you and I first met, Curtis, that was the big thing that I didn't know. I didn't know how much the bite also was influencing the head and neck and also influencing posture. That's what brought me to the first dental conference where we met for the first time 20 plus years ago.
So Jeff, share with us.
That's weird because you guys are only 29.
Yeah, thank you. That is strange. It's kindergarten. We're not getting older. But Jeff, share with me. I remember this very. I was sitting, I believe, on your left side, and I turned to you. What did I tell you at that the first time we'd ever met? What did I tell you at that dental conference?
Well, there was a nice dentist who I'd met from Seattle who introduced me to the one Calgary attendee, Dr. Westersund. He said, you'll like this guy. And so he introduced us. He said, Dr. Scholten, Dr. Westersund, Dr. Westersund, Dr. Scholten. And you said, oh, very nice to meet you, Dr. Scholten. How does it feel never to treat the cause of anybody's anything? I think it was something like that.
What a nice guy.
Well, Kira, you have to understand that dentists have egos. And unfortunately, our egos, maybe you've experienced this because you've known me for a while, dental egos tend to be very fragile. So when I meet somebody as impressive as your husband, I had to take a little jab at him to begin with.
knock them down a little. Yeah.
Well, but so what was interesting about that is that there's a classic here I took a long time ago that said when somebody kind of disagrees with you, try to find out more about their perspective, because maybe they have something that they can teach you about their perspective. And so I don't know if you remember what I said to you, but I said, "Oh, Dr. Wester, that's a very interesting perspective. Can you please explain that to me?" And you did a good job of that. You said, "Well, when somebody grinds down their teeth, right? Their head goes forward to get air.
Right.
And when their head goes forward because their head's heavy, it stresses their neck and back, and joints get stuck. And so chiropractors go in and pop and crack the joints," was your perspective at that time. And what you really needed to do was get the head back over top of the shoulders. And so little did you know how much we agreed on that final piece of your conclusion.
It was love at first sight. I got to admit that you kind of did impress me at that point in time. Now,
so Curtis, can I ask a question from an outsider's perspective here? So after meeting Jeff at the dental conference, you guys started collaborating, and so what have you seen since understanding more about how this type of chiropractic has helped? What have you seen with patients since you've started sort of noticing this?
So what I found, and again, this goes back to a dentist ego, and I kind of had to swallow mine, because what I found was that a lot of what I did with teeth was merely to support what Jeff did with the head and neck. So if he got stability, some of that stability was able to be maintained because there was not these interferences in the bite. So Jeff has solved problems for me, patients with chronic pain, patients that couldn't open, patients with migraine headaches and back pain, lower back pain, numbness in their hands, just a litany of things that I thought would be difficult for me to fix that Jeff fixed instantaneously, and I was just there to help support him. Jeff, what do you have to say about that?
I think it's a great question from Kieran. I'd love to hear it from you too, because I think that the exact opposite is true too. I think in our professions, we end up learning so much about what we're doing, and we don't learn about maybe how other professions can collaborate and can help us. And over the last 20 years, we've been able to see many times where I haven't been able to get a patient stabilized, and it's a bite issue. And so to have them be able to go to you and get your work and get a foundation for the bite, because they're chewing and swallowing all day long. And if the neck is being stressed by them chewing and swallowing, then it's really hard for me to get the kind of sustainable improvement that I want to get. And that's really been what I've been telling my colleagues for the last 20 years is, hey, this bite thing really has the potential to influence what we're seeing in our patients day to day. Find yourself a dentist that you can collaborate with, so that in those patients who need the extra help, that you can have somebody you can rely on to help you out, and it's for the best interests of the patients. It's the best interests of us as clinicians, for our professions. It's just been a wonderful collaboration for the last 20 plus years.
It has been a great collaboration. One question that I think everybody would like to know is, you work with the upper neck. A lot of chiropractors work with the whole body, but there are different ways that you treat patients than, say, a full spine chiropractor or some other type of manipulation that could take place. What is, besides chiropractors, what's the other type of professional that deals with back alignment or spine alignment?
Well, I mean, there's a lot of different professionals in the medical world. There's physiatrists that would be the people, and the physiotherapists spend a lot of time on spine and back complaints, and there's osteopathic physicians and practitioners that also involve themselves a lot with spinal health, and And so, yeah, it's an interesting situation when you talk about limiting your practice to something, because, again, your practice is mostly limited to the teeth and the bite, and yet you recognize that the teeth and the bite don't walk in by themselves, that there's a body behind that and there's a head that it's connected to, and that's a big part of the point that you're making. And so when I'm dealing with the upper neck exclusively, I'm checking leg lengths, I'm feeling backs, I'm looking at things, and none of us can help anybody with everything. So if we recognize what we're able to bring to the table, and then we can recognize maybe what other pieces of the puzzle are necessary for that patient, which I think you're exceptional at doing, by the way, Curtis, then you can curate a team with that patient that can help the patient find the solution that they're looking for. Because, again, if the solution's simple, then we all are happy for the patient and we're happy for ourselves. If all I have to do is a little adjustment to the neck and it's simple, we're happy. The patient's happy. You're happy if all you have to do is a little adjustment to the teeth and everything's balanced and there's nothing else going on. I don't think there's many practitioners that aren't happy about that if what they're interested in is the well-being of their patients. But the problem is that the average person I see has 10 or 11 chief complaints and is chronic, and the dysfunction is multifaceted and throughout the body. And so I don't think patients need to have only one chiropractor. I don't think patients necessarily need to have one dentist. I think that if the chiropractors and the dentists that are involved can collaborate and understand what each other are doing, then it makes a big difference. And I'm dealing with the upper neck, as you said, and that's the scary part. That's what we're sort of talking about this episode, is people are scared to have their neck adjusted. And so they're scared of having strokes. There's been associations over the years of strokes and chiropractic care. But those associations have been mostly proven to be not causal associations, but time-based associations. Somebody's having a stroke, they go to the chiropractor, they get adjusted, and then that stroke continues. And so in large studies that have been done to investigate this question was widely put to bed in about 2016, where they saw that people would have the same kind of strokes after seeing their medical practitioners as they would after seeing their chiropractors, meaning that it probably wasn't the manipulations or the chiropractic adjustments that were causing the strokes. It was probably more that the person had some underlying condition that continued to progress, but that created headaches and numbness and dizziness and different symptoms that weren't recognized by the practitioner prior to the intervention. So you don't have to be scared of your chiropractor. Anybody who thinks that chiropractors are causing strokes is typically dealing with old information. Now that research continues to evolve, and chiropractors want to understand it as much as anybody else, because we're here to help people, not to hurt people. Now, I hope that kind of addresses a little bit of that, Curtis.
That does address it. So, Kira, you talk to patients that are calling the office. One thing I think we should clarify is what are the cervical vertebrae? Because you get patients phoning and they don't know why what part of their spine is being treated, or
yes, some people do actually think it's just for women for the upper cervical. So we have to clarify that. Yeah. So it is the cervical spine, and both men and women have it. So we treat everyone.
And where is the cervical spine? Where is it on the body?
The first seven bones of your neck.
Okay.
But in our office, Jeff and the other chiropractor, Milan, they just are just at the very top of it. So I think you're palpating them all, right, Jeff? But really only dealing mostly with the top ones.
So Jeff, can you explain what is a NUCA adjustment or manipulation versus, say, some of the other manipulations that are possible?
Yeah, absolutely. I mean, the NUCA set of procedures is a way of doing things where we do an image-guided adjustment to the upper neck to try to realign the head on the neck. And so we take some images before we adjust the first time, and then we try to calculate how mathematically things are supposed to go using levers and vectors and things like that, fancy things like angles and forces. And then we try to deliver an adjustment, which is not a manipulation, down an angle that we've calculated should work for that patient. And then afterwards, we take another x-ray to see if it did work and what part of it worked, and make sure that the person responded the way we expected them to respond. And if not, then we adapt what we're doing and customize it to that person. So the first intervention for us is really about figuring out how to adjust a person. And our adjustment, when you're doing the NUCA adjustment, it kind of feels like having your pulse taken. It's the same thing that happens when you hit a golf ball well or you hit a baseball well. You don't really feel it. If you shank it, it hurts, but we don't shank them. So it's a very nice experience for the patient typically.
Kira, do you ever describe it as the NUCA tickle? Because sometimes
a lot of patients come out saying that it feels like voodoo magic, because it's a very underwhelming adjustment in that it literally, you're like, what are you guys doing there? It feels like you're not doing anything, and it's really, really remarkable. You see the patients come out and they're a little confused, but extremely happy.
Now, Jeff, does every chiropractor know what NUCA does? Is it common knowledge of how you treat versus, say, a more manipulation of the joint? Do people understand that in your profession?
Yeah, it's kind of uncommon knowledge, Curtis. I think you know more about it than the majority of chiropractors do. When I was choosing a school to go to, I was really impressed with the NUCA procedures as an undergraduate student, and so I decided that was something that I wanted to learn and investigate. And there are a few schools in North America that teach this procedure, and so if you're somebody who wants to learn about it, then you should reach out to a NUCA chiropractor in your area and find out who's teaching it at the moment. But there's a number of colleges, 5 in the United States, that teach it. But currently there's no international chiropractic colleges that teach it. Chiropractic is spreading around the world, but the scope of practice for a lot of chiropractors doesn't involve taking x-ray. And so in Europe, for instance, none of the schools teach techniques such as NUCA yet. But we're hoping to change that someday so that they can have these very precise forms of chiropractic that their patients can benefit from as well.
And precise is exactly what I love to get from you, because we have to make the bite precise, and we can make a bite to somebody like this, or we can make a bite to somebody like this. Which would a patient want? It becomes quite obvious to the patient, I think, that you're a very precise part of this. So this has been a great conversation. Jeff, I want to have more conversations with you, and hopefully, Kira, you can be my guest host.
For sure.
But there's a whole bunch of specific symptoms and things that I don't think a lot of people understand. And it's going to be really great if we can have more of these. Are you guys up for more of these little talks?
Yep, I'm in.
Love to.
Thank you ever so much. And I just want to say this is from the Teeth to Toes podcast, part of TMJ.today, where we're trying to educate both patients and dentists about some of the options of treatment that can be available and how they would help. And I really want to thank you for listening in. And I really want to thank you, Jeff, and you, Kira, for assisting me in getting this done. I think it's going to be a great help for people.
Excellent. Happy to be here.
Thank you.
Thank you very much from Teeth to Toes.